wide range of interventions. So, what is one very popular way public health would be working right now? Because we're talking about immunization campaigns. They work with urban design. So, right now, with what's going on in the world, how would somebody in public health be working to campaign? What do you guys think? Can anybody tell me? Well, Maria, you've already been through the course, so you're just going to see a repeat of the information. But if you'd like to answer the questions, that could definitely be great. Okay. All right. So, can anybody tell me, somebody in public health, what would they be working with right now with COVID? Does anybody have an idea? What might they be doing during COVID? They're the ones that are working with vaccinations, right? Very good. Yes, they're the ones that are kind of working with lockdown, working, with the government in that. Thank you, Diel. They're giving out masks or at least advocating for masks. And of course, they're doing research, but it's not only public health that's doing research, they're presenting the research to the community. Okay. Med school boy, please refrain from using the chat for anything that's not productive. Okay. All right, you guys. So, meanwhile, medicine, on the other hand, is going to be dealing with not only prevention, but also diagnosis and treatment of the individuals, right? So, of course, we're talking about medication, surgery, and other forms of intervention. Yes, Summer. So, people in medicine are more so trying to find out, how do I cure sick people? Okay, that's correct. All right, you guys. So before we continue with the different specialties and branches, let's go through and see what are some specialties you guys are interested in. So, does anybody have a specialty that they would want to go into, whether that be pediatrics, family medicine, I don't know, neurology, surgery? Anesthesia, okay. David wants to be an anesthesiologist. Neurology, wow, we've got two neurologists in the house. Pharmaceuticals, Tony, that is a very lucrative field. I encourage you to move forward with that. A chemist, Miles. You know what? You do not have to know yet med school. Honestly, when you go through your rotations, that's when you'll really figure out what you want to do, because people change their minds sometimes. We'll talk about what rotations are. Wow, development on virus apps to show how virus or bacteria acts. You know what, Dial? I think you might want to do something with a mix of microbiology, pathology. That sounds like what you'd want to go into. Summer, you want to be a vet? That is amazing. Hey, doctors, and I'm sorry, doctors help animals too, right? Sterile processing. You guys are amazing. Wow. I don't know the basics of medical medicine. Will I learn about it? I want to be a surgeon. Absolutely, honey. All doctors learn about the basics of medical medicine. I've been to medical school. You have to learn the basics because that's the foundation that, helps you become a doctor. Yes, Maria is an EMT. I am looking forward to her input. All right, you guys, that's great. So we are going to go ahead and jump into the different types of specialties and what they entail. Okay. I'm interested in finding more research on what makes allergies develop and how to cure them. Rose, that is great. That's why I said I have so much hope for your generation of doctors, because you guys have so much technology to work with now. All right, guys, let's go ahead and jump this in here. I was not a doctor. I actually switched into administration in hospitals. All right. Okay, guys. So OBGYN, these are called obstetricians, okay, as well as gynecologists. So the OB is for obstetricians, the GYN is for gynecologists. Now, of course, they are going to be caring for women during pregnancy, after the baby is born, and they also help deliver babies, okay? So an OBGYN is trained to do all of these things, and they also will help with birth control, okay, childbirth and menopause, which is what happens when women get older, right? Cardiology, of course, is the study and the treatment of disorders of the heart, as well as the blood vessels. Geriatrics is dealing with the health and care of old people. The population is getting older, guys. You guys know the baby boomers are just getting older and older, right? And unfortunately, geriatrics is suffering for physicians at the moment because a lot of physicians are going more so into, family medicine or internal medicine, and they're lacking physicians in that field. Now, orthopedics more so will be focusing on, let's say, the care of the musculoskeletal system. So, the musculoskeletal system is what? Can anybody tell me? What does musculoskeletal system composed of? Your mom took nursing school? That's amazing, Abby. Nurses are just as important as doctors, and don't let doctors tell you otherwise, okay? You guys do more work than the doctors sometimes. So I think nurses can be more important sometimes. Very good job, you guys. Yes, it is the muscles and the bones. Excellent. You guys are going to do great when we do medical terminology later. Not necessarily the veins, Summer. The veins would more so be dealing with the blood, right? All right, guys. So orthopedic is more so going to be helping people with sports injuries, people with joint pain, example, arthritis, right? Or back problems. So they kind of are doing a form of rehab in a way. All right. Now, surgery, we had some surgeons in the house. This is the treatment of injuries, diseases, and other disorders by manual or instrumental means. That means that you're doing invasive procedures, right? You're cutting into people, you're fixing what's wrong, and then sewing that person back up. Autoimmune disease would fall more so into immunology, Dial. That is a great question. Physical therapy is something that we'll see further on, but let's continue on here to anesthesiology. Someone was interested in that. Now, this medical specialty is more so concerned with perioperative care. What does perioperative care mean? Is it before surgery or after surgery? It's both. That was a trick question. Okay, so perioperative care is both before, during, and after because they will give the anesthesia before the surgery. They're going to be there with the surgeons because they want to make sure that the patient is still under anesthesia, right? And then after surgery, they will help the patient recover. Now, radiology or a radiologist will be using imaging technology in order to diagnose and treat disease. What is a very popular imaging technology that a radiologist might use? Can someone tell me? An X-ray. Very good job, you guys. That is correct. So physical therapy is similar to rehabilitation, right? So a physical therapist and an orthopedics might actually work together. The physical therapist is going to make sure that they are restoring the health of the patient through physical examination, diagnosis, patient education, especially, okay, to help them recover, physical intervention, rehabilitation, of course, disease prevention, and health promotion. So, physical therapists can work in hospitals, they can work in schools, they can work with sports, they can work literally everywhere. All right, you guys. Now, let's talk about some specialties or branches that are similar but a little bit different. Do therapists undergo the same education processes with other doctors? Tony, that is a great question that I hope is answered here as we look at the differences between psychiatry and psychology. So, psychiatry will be treating complex conditions requiring medical treatment and psychological evaluation. Now, they're typically treating extreme diseases, not diseases, I don't want to say that. Let's say extreme mental health issues, okay? So for example, schizophrenia, bipolar, severe disorder. Now, psychiatrists are allowed to prescribe medication. Psychologists are not, okay? So they're more so treating conditions that don't they're not as extreme, let's say. So more so behavior problems. So psychologists do work in schools for children that might have behavior problems in the classroom. They work with learning difficulties, anxiety, and mild or, small cases of depression. So, yes, Tony, to answer your questions, they absolutely do undergo the same education processes. I think the only difference for psychiatry and psychology is maybe they don't have to go through rotations. I think their rotations is specifically focused on, mental health issues and treatment of those things. Okay. Imposter syndrome, well, honestly, it's not a mental health issue. That's something that us as humans just have. So it's not something that would be dealt with by psychiatrists or psychologists. It's more so self help, right? Once you get older, you start to understand imposter syndrome, and you kind of overcome it and do what it is that you have to do, regardless of if you feel like, you're not good enough or that you can't do what it is that you're striving for. That's a great question. All right, guys, let's jump into pathology versus microbiology. Now, pathology is the study of the nature of the disease. So it's studying the actual disease itself, the causes of the disease, how it progresses, okay, the development and the consequences of this disease. Microbiology, on the other hand, is more so dealing with the microorganisms. So in micro, you would be looking at the bacteria, the viruses, things like that. And they more so focus on the effect on the man or other living organisms. Yes, I liked micro and patho actually. That's the abbreviation we give it in in med school. I enjoyed micro. It's a lot of information though, but it's very interesting to see how germs and bacteria really affect people. I became OCD for like 2 semesters after micro. I was like, everything needs to be clean all the time. All right, you guys. Now let's talk about the different types of medicine, okay? Because there's traditional medicine and alternative medicine. Now, traditional medicine, of course, this is what we are more so used to in the medical field, right? We do incorporate plant into our medication. So we incorporate plant, animal, and mineral-based medicines into pharmaceuticals. There are some spiritual therapies that are more traditional, manual techniques, exercises. All right. And of course, we do this in combination with treating, diagnosing, and preventing illness and maintaining well being. Summer, I know I saw you raise your hand, but if you have a question, go ahead and put it in the chat, okay? Emma, that is a great question. She asked, which one is better to use? Honestly, that is subjective. That means that it depends on the patient, okay? Because you got to understand, traditional medicine is great. It's been working for more than years, right? It's been working for decades. And so certain procedures, for example, surgery, things like that, there's nothing in alternative medicine that would help that. You can't replace surgery with that. However, for more, I would say non-serious measures, I would prefer alternative medicine. That's just me. So for something like a cold or something along those lines, if I'm not going to go to the doctor to get medication for that, right? I'm gonna eat, chicken soup and get my vitamin C into my body and drink lots of ginger tea. And so that's a form of alternative medicine, right? Because they use more so natural medicine, as you can see here in this picture, herbs and things along those lines. So traditional medicine also uses these things, but they combine them with, chemicals and other aspects to enhance what the plant has. Now, alternative medicine is becoming more and more mainstream. That means popular, right? And so more than half of the adults in the United States have said that they actually use some form of alternative medicine. Abby, that is a great question. Is essential oils part of alternative medicine? Absolutely, it is. I am an essential oils advocate. I love it just can do so much, and if you were to go into holistic medicine, then you would learn more about that. Vitamins are technically traditional medicine, Miles. I would say vitamins do fall under that category.
Which ancient medicines and treatments do we still
So the video was just ready to go. All right, you guys, do we have any questions or anything before we go into this video here? None so far. All right. I'm glad you guys have been able to, stay with the topic so far. So, no, we do not need to take notes, Abby. This is just general information for you guys. All right. Okay, you guys, we're going to go ahead and watch this video here. And our plagues involved in this video, judging by the bird doctor, Kellyanne, you are very perceptive. Are these posted in our learning labs? We do not have learning labs, Tony. This is more so of an informative session, an informative course, I would say. I will include links to certain YouTube videos that we watch. But other than that, this is more so for you guys to understand more about the medical field since you guys are interested in it. Okay, guys, we're going to go ahead and play the video here.
Used today. Medicine has been around for a long time, a very long time. Using herbs and stones to heal predates the written word. The first known use of dentistry goes as far back as 7000 BC. Evidence of early brain surgery called trepanation has even been found in human remains from the Neolithic era. Of course, those surgeries may have been used to chase away the evil spirits. While medical knowledge has come a long way since the days of leeches and bloodletting, some historical treatments may have been ahead of their time. For example, the use of bronze. Thanks to archaeological digs, bronze medical tools have been discovered in the early Roman Empire and ancient Mediterranean areas. But why is bronze so important? Bronze is an alloy primarily made up of copper, along with other metals. Whether our ancestors knew it or not, copper has antimicrobial properties. And even as an alloy, bronze still possesses some of copper's antimicrobial effects. While these ancient bronze tools didn't sterilize themselves, they were much safer than other metals and helped against infections after contact with the skin. To this day, we still use copper in medical devices, partially due to its antimicrobial properties. Next up, aspirin. While there wasn't the little pill in ancient times, there were willow trees, which are packed with a chemical salicin, a precursor to acetylsalicylic acid, aka aspirin. It's been documented that at least as far back as 2000 BC in ancient Egypt and Sumer, willow bark was used as a herbal remedy for inflammation and pain relief. In fact, the father of medicine, the ancient Greek physician Hippocrates, wrote about medicinal benefits of reducing fevers with willow wood in the 5th century BC. By the 1800s, chemists began to experiment with the chemical salicin, combining it with acetyl chloride, which ultimately led to the creation of aspirin. And speaking of plants, in 2015, the Nobel Prize in Medicine was given to the makers of artemisinin, a compound drug to fight malaria. And the plant from which the drug was developed? Wormwood, an herbaceous plant typically used as an ingredient in absinthe. It was discovered after researchers scoured writings from ancient Chinese dynasties, specifically those from the 4th century Jin dynasty. In the olden text, the team learned that wormwood was used to fight many of the symptoms and ailments associated with malaria. The drug developed from it has saved millions of lives. Tu Yu, the Nobel-winning researcher who helped discover wormwood's medicinal properties, had this to say. Artemisinin is a true gift from old Chinese medicine, but this is not the only instance in which the wisdom of Chinese medicine has borne fruit. While there are many medicines that are based on ancient remedies, there are also so many different procedures and treatments that come from the past as well. There are records of ancient Egyptians using sutures, surgical stitches, as far back as 3000 BC. The use of the narcotic opium, the active ingredient in morphine, as a medicine can be traced to around 1500 BC. One of the biggest takeaways is the practice of knowing which conditions are possible to treat and which are incurable with the current means. In the Edwin Smith Papyrus, named for the dealer who bought it in 1862, ancient Egyptians not only had the ability to diagnose patients, but also had detailed instructions on how to classify patients into 3 categories. The different categories are determined by the severity of the illness or injury, as well as the limited medicine available. The first category is an ailment with which I will treat, or in layman's terms, take 2 and call me in the morning. The second category is an ailment with which I will contend, or get them on the operating table, stat. And the third category, an ailment not to be treated. Basically, we've got some bad news for you. It's similar to the system triage units use in the United States. Patients are categorized with green, minimal, yellow, moderate, red, immediate, and black, presumed dead, tags to classify how to treat them. The diagnosis and categorization system for treatment dates at least as far back as 1500 BC. Much of our medicine today is based off of thousands of years of different procedures and treatments, some of which we still use to this day. Who knows what procedures we will still use 1,000 years in the future? Because science.
All right, you guys, what questions do you have? Dial asked, why did doctors during the plague wear bird-looking masks? Honestly, I'm not quite sure why. I think it was something to do with they thought it helped. And it kind of was like masks that we're wearing now, right? I think they thought that it might have helped them. All right, what questions do you guys have? I'm going to actually Google that. Why did doctors wear masks during the plague? What is morphine? Very good question, Gabrielle. Morphine is a medication that we give in order to decrease pain in patients. Okay. Oh, did they put herbs in the masks? I wasn't aware of that. Let's see here. Oh, that is correct. Well, you learn something new every day. So the plague doctor costume, the beak could hold dried flowers, example, roses or carnations, herbs like mint, spices, camphor. We still use camphor today. Does anybody know how we use camphor today? Well, have you guys ever heard of like icy hot patches or Vicks? That's how we still use camphor today. Camphor is one of the main ingredients in those types of therapies, or vinegar sponges. So the purpose of the mask was to remove bad smells. Oh, I didn't know that. I thought it was used in treatment of the treatment. Yeah, the ice hot packages or the patches rather. That smell, that's the camphor that you're smelling. All right, that was very interesting. Okay, you guys. Well, if we don't have any further questions, I don't believe it's essential oil, but I do think that it might be some type of oil. Tony says the conclusion from the video, medicine and treatments can be traced back from thousands of years ago. It's just that they are in some way different. Yeah, they are in different forms, but they are still the same. That is correct, Tony. That's why I said, we've been doing certain practices for years as well. It's just that nowadays we have, let's say, made it a lot better than it used to be, right? All right, you guys. So we are going to continue on here. Is wormwood the only thing that helps prevent malaria? It's not the only thing. Of course, hygienic practices would help a lot, but malaria is actually transmitted via mosquitoes, right? And so the best way to really prevent malaria would be to avoid being in areas with high levels of mosquitoes. Depending on where you live, that's not always possible. Okay, but there are different measures you would use to combat that. So, guys, let's move on to the different types of doctors. Now, typically, and this is your first lesson in medical terminology, many doctor types will combine the specialty with the ending IST. So, a doctor practicing psychology is a what? Can you guys tell me? A doctor practicing psychology is called a psychologist. Very good job, Sid. Sid got that one first. So a doctor practicing cardiology is a cardiologist. Very good job. A doctor practicing neurology is known as a neurologist. Excellent job, you guys. A doctor practicing gynecology is what? What are they called? Gynecologist, very good. Diel's like typing so fast. So a doctor practicing microbiology is what? That's a microbiologist. Very good, Gabrielle. A doctor practicing radiology is what? Good job, you guys. I see you, David and Sid. Radiologist. Excellent, Dial and David. Okay, so, oh, Kellyanne, a doctor practicing psychiatry is not a psychologist. What is it? A psychiatrist, not a psychologist. You guys are just making it up now. All right, so yeah, this one's a bit different. A psychiatrist is what that one would be. All right, Tony says, what is the difference between a cardiologist and a cardiac surgeon? That's a very good question. So, a cardiologist would not necessarily be doing surgery. They're more so going to work with patients who have high blood pressure, patients who have any type of heart disease, okay, blood clots, things along those lines. So, let's say the cardiologist is working on diagnosing the patient and giving medication, of course. And then if that does not work, then they would refer someone to the cardiac surgeon if they needed to, do surgery if it got to that point. Okay. All right. You guys did a great job. Miles, no need to apologize at all. I know you guys were rushing to try to type the answers. So, as I said, this is going to be an introduction to medical terminology because we're going to learn more of the medical terms that we use within the medical field. So, do we have any questions at all here, you guys? Questions, comments? What was the Black Death, aka the plague? Well, the Black Death was a plague. So, a plague is basically a disease that spreads and they cannot contain it. Okay. It is kind of like COVID, but thankfully, guys, COVID is nowhere near as bad as the Black Death. And I actually have a video for that. Would you guys like to watch it? It's basically showing the common pathology rates of a lot of, let's say, diseases. Yeah? Okay. Can I show the surgeon slide again for a second? What surgeon slide? What is dermatology? Dermatology is a branch of medicine, Tony, and we're actually going to learn more about it during the next class because the next class we're going to specifically look at the type of doctors within medicine. And so we're going to explore so many more branches than we saw today. Okay? All right, you guys have so many good questions. Okay, so let's watch this video really quick. It's only about 3 minutes, and then I will address you guys' question. Okay. All right, you guys. So you can see how the COVID is actually nothing compared to the bubonic plague and the Black Plague. Like those had way higher mortality rates, surprisingly, right? I don't even want to know how bad it was back then, given how bad we are experiencing it now. So let's go back through some of these questions here. Someone asked, would Vicks vapor rub be a traditional or alternative form of medicine? That would technically be, I guess you would say traditional, because they would have had to develop the formula itself, right, in order for it to be effective. And so that would more so be traditional medicine. Now, if you were using the camphor by itself, only camphor, then that would be alternative medicine because it's the source itself, right? Somebody said, what's the monkeypox, tetanus, and MRSA? You know what? You guys are amazing. We're actually going to break down diseases in one of our future sessions. And so what I'll do is I'll go ahead and make a note of that so I can include it in that presentation, okay? So monkeypox, MRSA, and tetanus. We will talk about that. And you guys will actually get a chance to play doctor because you guys are going to be diagnosing some patients in our future sessions as well. Okay. All right. So let's see here. You thought COVID-19 was more dangerous than SARS? A lot of people thought COVID-19 was. Okay. The video that we just watched, Miles, I'm going to send you guys that link via email. Okay. So the summary of today's class will include both of the links for the videos that we watched. All right. Okay, you guys. Well, someone had asked me to go back to the surgical
Which ancient
aspect. I'm not sure if you were talking about this presentation here. Is this what you were talking about in terms of the treatments? When the flu hit, did we do everything we did with COVID now? Abby, I think the flu has been around for a long time, in some shape or form, of course. I'm not quite sure because I'm not familiar with when the flu actually became the flu, right? But I'm sure back then they probably tried to do the same thing. Of course, the term of quarantine and that kind of stuff, that's a new concept. That's a newer thing. Anthrax is pretty dangerous, guys. You guys are a little bit younger, but when I was in high school, I remember there was a very big anthrax scare. People were putting like anthrax powder in mail. It was a very big thing for a while when I was in high school. You guys might have been babies, but I feel very old right now. Okay, guys, so let's go ahead and continue on here. We're basically at the end of the session. Oh, that basically is the end of the session. Any questions at all, you guys? Is there a specific branch of medicine that studies the history of diseases? Uh, Not technically the history of diseases, Diel, but they more so do, research on diseases, and that is what we call epidemiology. Epidemiology. Okay, and we're actually going to talk about that in our upcoming session where we talk about the different types of subjects that you guys take in medical school. Was the bird flu worse than COVID? I think the bird flu might have been worse than COVID, but I'm not quite sure. Is MRSA a superbug or a parasite? Gabrielle, that is a great question. You know what? It is not a parasite. I know that for sure. I don't believe it's a superbug either. I would tell you go to Google for that one. Okay. How do you get mad cow disease? That is a great question, med school. You get mad cow disease from cows, and think about it as it's like the cow equivalent of rabies. So we get rabies from like dogs or cats, right? But you would get mad cow disease from cows. Okay. Is scarlet fever worse than COVID? Honestly, I'm not sure, Emma, because scarlet fever is not as common these days. We have been able to bring that down a lot. All right. So let's see here. How long was I a doctor? Summer, I never actually became a doctor. I went to medical school, decided that I wanted to do administrative practices instead. And so I went into administration. after medical school. Okay. So, yeah, well, we're basically at the end of the session there, Miles. Thank you all so much for your time today. Rabies has the same death rate as mad cow disease. Well, that sounds about right. Okay. All right, you guys. Well, we are going to go ahead and end this here. Thank you so much, Tony, for your time. We are going to continue exploring different subjects in medicine for our next session, guys. We'll look at the different types of doctors, what the doctors do, and things along those lines. All right. I hope you guys have a great day, and I will see you guys, I believe, on Wednesday. Bye, you guys.
Recording stopped.